接住落嚟，我哋好榮幸邀請到英國國民健康服務體系及英格蘭公共衛生署健康及工作專家顧問 Professor Dame Carol Black。佢同時出任英國國民保健署僱員健康及福利改善諮詢委員會主席，亦係前劍橋大學紐納姆學院院長。佢將會為大家介紹下英國喺實踐健康工作間文化方面嘅經驗。
It's our honor to have Professor Dame Carol Black from UK. She is the expert advisor on health and work to NHS England and Public Health England. She chairs the Improvements Advisory Board on Employee Health and Wellbeing of NHS. Also, she is the past principal of Leland College, Cambridge. Today, she will share with us the experience on implementing a healthy work culture. Professor Black, please.
Good day. It's such a great pleasure to join you at your conference and to talk about implementing healthy work culture and our experience in the United Kingdom. Before the pandemic struck, many organisations were accepting that good health and well-being are important to work and productivity. We were gradually creating a healthy work culture in organisations, big and large, public and private. And that culture was based upon inspiring leadership, capable middle managers, and board engagement in promoting employees' health and well-being. And then, of course, came COVID, and COVID affected all workers. Frontline workers were obviously at work, but they had increased health risks, both physical and mental, and burnout being a real issue. Home workers, many people were at home working. Some people like it, but for some, it's not a good place to be, and they wanted to be back in the workplace. And then in the United Kingdom, there were many people put on what we call furlough, where the government paid for and supported them being at home. That, of course, solved the financial issue, but it didn't solve the issue of being deconditioned to work, getting out of the habit of going to work. And we know that for some people, they lost their jobs. And there is a large mental health deficit associated with unemployment. And then on top of all that, people worried about returning to their place of work. Some are challenged by it. Some are frightened. Of course, there are many people who welcome it. But overall, we know from figures that our population suffered both physically and mentally. Our Office of National Statistics recorded that our well-being had seriously deteriorated. Of course, we can always go to HSC, our Health and Safety Executive, for good and reliable figures. These are the UK stats for 2021. You can see that 0.8 million workers suffered from work-related stress, depression or anxiety, and 0.5 million suffered from work-related musculoskeletal disorders. And of course, if you're working at home without proper conditions and you're not ergonomically sound, and you're having to perhaps even work from your kitchen table, then it's quite likely that you're going to suffer from more musculoskeletal disorders. You can see there their figures for the coronavirus pandemic, and 93,000 workers suffered from COVID 2020-21, and 0.6 million workers suffered from a work-related illness or caused or made worse by the effect of the coronavirus pandemic. The 93,000 were people who believed that they might have been exposed to coronavirus at work. And these estimates are based on self-reports from the Labour Force Survey. COVID-19 did something else which is really important. COVID-19 fully exposed the vital relationship between the economy and health. We knew, of course, that health was important to the economy, but during the pandemic, we in the UK and around the world saw that people who had chronic health conditions or who were deconditioned or obese did worse with respect to their own health and ability to work. and many such people sadly ended up in our hospitals and in intensive care. However, we do need to find some good things that happened because of COVID, and we can see COVID as an opportunity to accelerate change and to bring workers' health to being a high concern for our chief executives, our boards and managers. Looking at some research done by RAND Europe on health-related productivity in the United Kingdom, this is work that have been done over the previous 5 years. Workplace surveys with what is known as Britain's Healthiest Workplace Survey, a wellbeing assessment, which was done by Vitality Health, providing the educational grant with the analysis by RAND Europe, suggested that health-related productivity loss worsened from 7.8% of working days in 2014 to 14.6% in 2019. This, in fact, corresponds to an increase in 33 days per worker per year, and the estimated cost to UK employers about 90 billion per year. Workers' health is therefore crucial to productivity and the economy, and we had hoped that the changes that we were putting in place before the pandemic would improve these figures. Health-related productivity loss is mainly due to presenteeism, not to absence. People are present in their body at work, but not in mind. Presenteeism, we now know, is strongly connected with poor mental health, financial concerns, and inadequate sleep. This came out of RAND Europe's research on the Britain's healthiest workplace population. Presenteeism is not easy to measure, or at least not as easy to measure as sickness absence, where you just count numbers, but we do need to get used to measuring it, and there are some validated scores which one can use. If we think about presenteeism in a pandemic, the extent of presenteeism in our current crisis depends, of course, on its key drivers. So, for example, on poor mental health. Our Office for National Statistics surveyed just over 3,500 adults in 2020. 20% had experienced depression since COVID-19 took hold, against 10% previously, with 12% developing moderate to severe symptoms and 6% continuing to experience them. And then if you look at the figures for 2021, Vitality in its survey showed of its own workers that nearly 40% were experiencing stress, anxiety, and depression. The CPD Good Work Index showed that 43% of employees say their general mental health had worsened, this rising to 52% of those with existing mental health issues. A Sleep Council survey showed in 2,700 adults about 40% perceiving it harder to fall asleep, and some people have certainly reported the quality of sleep being worse. Underlying causes of presenteeism are accompanied by multiple other factors that could encourage people to be present at work when probably they shouldn't be. These factors include fear over job security, social isolation, and digital presenteeism, with more people now working from home and many finding it even harder to switch off and define clear boundaries between work and home life, often working through their lunch hours, often working maybe well into the evening or going back to their work after supper. Presenteeism, I believe, will be an even more significant challenge for employers in and after the pandemic, and more difficult to measure and manage if people are working from home. Some immediate issues for employers in the United Kingdom are health issues. Mental health, I've already mentioned. Obesity. In the UK, obesity was already a problem, but with COVID, Obese individuals twice as likely as the general population to be hospitalised and requiring intensive care. And for many of those people, the return back into the workplace is a difficult and long one. Addictions, we've seen a big increase in alcohol consumption. Tobacco and drugs are also a worry. And we know that some communities have suffered more in the United Kingdom than others from both drugs, alcohol, and an increase in smoking. We then have a new condition called long COVID, which is causing work disability, the true extent of which as yet we're not fully aware. And then, of course, what about all those workers who maybe needed a new hip replacement, a new knee replacement, may have early cancer that needed to be diagnosed? All of these things have been delayed. Late diagnosis of malignancies are a big worry to us, and these will, of course, all have affected the workplace. And then another big issue for employers is place. Before the pandemic, we were all sitting in our offices. Now, many, particularly office workers, are at home, working from home, juggling family responsibilities. We have to remember this is an enforced experiment, done very quickly, not by choice. And if it had been done by choice, would it have looked like it looks today? I don't think we can draw any hasty conclusions of what will be the ultimate outlook and the ultimate landing place for hybrid working. I looked in some of our big broadsheets, our big papers, to see what the comments were. And these comments are mainly taken from 2020 and 2021, early in the year. Dominic Lawson, number 10, should support working from home. He said productivity is up. That, of course, is still questionable, I think. Families are happier. Life out of the office is infinitely better. Here's to the end of office life as we knew it. Then back for good or bad when we were thinking, and for a short time went back to our offices. Comment returning to the office will be tricky. But then there are people who think office life is more precious than we admit, and that Zoom meetings are no substitute for the interaction and the friendship that we find in workplaces. Another comment, Zoom forced me to reappraise the simple phone which cut through the endless email chains on WhatsApp pinging. I think we're in transition, and I don't think we know where this is going to end. But at the moment, I think it's fair to say that workers' post-pandemic expectations are expecting more mobility, choice of where they work and which days of the week they work there. They're used to more privacy, many of them. Working from home allowed them to be working on their own. They dislike what is present in many offices, which is unassigned seating, great concern about sharing, and health and wellbeing in the workplace has similarly risen to almost top of the agenda. So these are some of the expectations of our workers post-pandemic. I just want to reflect very quickly on how revolutionary is this change. There's a very good book written in 2010 by Richard Donkin, The Future of Work. And he says the history of the way we live and work is more evolutionary than revolutionary in nature. He could almost have been writing about what's been happening in the pandemic. He says our habits are shifting from one norm to the next. Industry to knowledge services, office to home, collective to individual, process to project, formal working hours to discretionary time, and work across boundaries. All of these things have been happening to us. Each migration contributes to the changing face of work. And these migrations are experienced in different strengths across different sectors, industries and workplace. They won't all be happening in the same sectors at the same pace and at the same time. When he looked forward and his policy agenda moving forward for the new work, when you look at this list, it is so much what is happening today. Home interchangeable for office. Give people discretion and autonomy so that they can choose how they spend much more of their time. This is so important today. Insist on relationship experience and empathy. Compassionate leadership is truly important today. And promote employee health and well-being with well-designed interventions and monitoring of outcomes. And he, of course, wanted to get rid of the concept of retirement. So this change was in the offing, but of course the pandemic has hastened it. But I don't think we need to be too depressed or too worried, because I think the essentials were the essentials before the pandemic. I think the essentials are the essentials after the pandemic. And these essentials, to my mind, is that there's no healthy work culture without leadership from the top of the house, line management capability and support, board level engagement with staff health and well-being, and they're of even greater importance post-COVID. Don't just stick over the cracks by putting on the mindfulness classes, the yoga classes, the better food. All of these things are important, but you have to get the essentials right. I just want to discuss one or two of those. I've taken the NHS as my example of leadership. Simon Stevens became the leader of the NHS in 2014. And you can see there he said NHS employees need to be healthy, mentally and physically, have good well-being and fully engaged so that we can improve patient outcomes. He took this forward through a series of actions in his 5-year forward view. In a summit in December 14, he created an advisory board, which I had the privilege to chair. And over those years, from 2015 until now, we have been developing for the NHS staff health and well-being activities, interventions, and most importantly, a framework on which it's all based. This is the updated framework. It was recently published, and over those years, we've been adding to it and improving it. One thing we had missed in the beginning was the importance of the OH organisation, its design and its possibilities within the health service. We hadn't paid enough attention to physical workplaces and facilities for rest, recovery and success. The pandemic taught us about that. And we hadn't really thought carefully enough about bringing your whole self to work, getting that work and home balance right, and giving people purpose in work, potential and recognition. So this is a living framework, but one that we're now rolling out to all of the organisations in the NHS. Just a quick word about occupational health and its future. The pandemic showed its value and that we need to pay more attention to it. And for the future, we require a better central, that is government central, understanding of and commitment to the need for occupational medical input to strategic decision making. And that's both nationally and at a local level in NHS organisations. And we really felt very strongly that the voice of OH, the director of OH, should be heard at the boardroom table. And we liked the idea of a corporate medical director, and that should be encouraged both within the NHS and outside of it, because it would bring great depth and breadth of knowledge to support a healthy, engaged and high-performing workforce. And this is our latest piece of work for the NHS called Growing Occupational Health. Certainly not going to read out everything that's on this slide, but our vision is improving health and well-being of NHS people by growing and developing NHS occupational health services. And you can see there how we're planning to do it and how we're hoping to empower the leadership in the NHS for service improvement and, importantly, for innovation. We need to grow the capacity and the capability of this workforce. Board engagement is truly important. This is taken from Britain's Healthiest Workplace survey data, 2018. There were questions in there, about the frequency of discussion at board level about health and well-being. And you can see if it was never or rarely discussed at board level, it affected business outcomes. It affected mental health. It affected culture. If it was done annually, then there was certainly some improvement. But it looked as if the best time was about twice a year. And there you can understand that red is the worst outcome, green is the best outcome, and yellow is an in-between outcome. So board engagement and discussion of health and well-being of the workforce is just as important as financial discussion. This study was by the Institute for Employment Studies, and it occurred in January 2021. I think it's really important to note that working from home exposed managers who lacked empathy, limited interpersonal skills, not suited to the complex demands of people management. And therefore, moving forward for organisational stability, future growth and the right culture, then there is the need to look at managers' suitability for the task and develop training curricula that strengthens new people management competencies, future shape of work demands. And we know that working from home has changed the line manager interaction with their workforce. We do have some information that is extremely helpful. So this was a 2019 railway study. It was a randomized controlled trial. And the message I want to give from this study, which was looking at training managers in mental health capability, either face-to-face or e-learning, compared to no training. 215 participants, and many had managed mental health issues at work and not found that always good. And so the learning outcomes was, had it improved their knowledge, their confidence talking about mental health, and their preparedness to take action. There was baseline measurement, and then 6 weeks later. One of the good news was that there was little difference between face-to-face and e-learning. Significant immediate improvement on all three outcomes, and usefully sustained outcome for knowledge and preparedness. So I think we should ask the question of how can managers function effectively with home working. It's really important that there's clarity, specificity, and consistency. Empowerment and trust is crucial. An individualized approach, understanding the unique pressures and circumstances of each team member, and then really paying attention to physical and psychological safety. Out of sight, out of the office, simply must not mean out of mind. I think these four things are truly important as we move forward. Just two products that I think you would be interested in and are important. HSE Working Minds campaign has just started. It's wonderful to see the Health and Safety Executive supporting stress and mental well-being in the workplace. They say work-related stress and poor mental health risks becoming a really health and safety issue crisis for UK workplaces. They give us the figures for the number of working days lost, and how Mind, our biggest charity for mental health, has suggested that 40% of employees have worsened in the pandemic. The campaign helps businesses recognise the signs of work-related stress and makes tackling issues routine. HSC has wisely called for a culture change across UK workplaces and acknowledges that psychological risks need to be treated the same as physical ones. So I think that is an excellent campaign that has recently launched. And then recently published, which is something you may be interested in, is putting science to work. the COVID pandemic has radically changed, and the Wellcome Trust acknowledged this, as did the head of health and healthcare at the World Economic Forum. The nature of work accelerated the need for employers to prioritize mental health and well-being in the workplace. And the World Economic Forum has partnered with the Wellcome Trust in supporting a collective effort to develop a more evidence-driven approach to employee mental health. And that publication there, Putting Science to Work, lists their first set of projects where they have really tried to be evidence-based, science-based, and they're now trying to get that information out. And they're continuing this work and doing the next round of projects. So you might find that publication useful. So in conclusion, necessary action by employers. I've listed some of them. Of course, there are others, but please ensure that mental health is top priority. Demonstrate compassionate and empathetic leadership at the moment. Develop managerial capability and flexibility. Communication, truly crucial when part of your workforce may be at home. Listen and respond, and if possible, make your interventions evidence-based and try and monitor the outcomes and report on them. And realize what I said at the beginning about presenteeism is really important. Presenteeism is reflecting the mental health of your workforce, the financial health of your workforce, and important things like their ability to sleep well, and ensure risk assessments are in a prevention-based approach. We're in a time of change, and in times of change, learners inherit the earth, while the learned find themselves beautifully equipped to deal with a world that no longer exists. So we're in uncharted territory. We must innovate, inspire, and be flexible. Thank you.
Thank you, Professor Black, for an enlightening and inspirational sharing. 聽完 Professor Black 分享英國嘅經驗，相信大家都獲益良多。